'cause I think I just got lost in your eyes. I have to tell you, I really want to. Whenever I look in your eyes, I won't make the same mistake twice. I'm ready to shake up and break the ice. Don't walk away, there's more to say. I just need the courage to let you know what's on my mind. Like every time you pass by, something just feels right. Not everything is energy locked up. It's ready to stay in the shower. Won't make
Hi, very good evening. Hi, Srish, Niharika, Regina, Abba, Sejal, Deepak, Jeena, Shilpa, Sahiti. Hi, Jadhav, Shivranjani, Prithvi, Priyanka, Anupama, Shruti, Preeti. Hi, Deepthi. Hi, Kedar. Hi, very good evening. Hi, Pradeep. Hi, Shoaib. Hi, Akshit. Cool. Hi Neetu, a very good evening. Right, so today we shall have a few important points in the form of self-assessment questions, right? So we have done this last week, so we'll continue the same. So I'll be asking you a few questions. We shall have a discussion among those questions, right? Yeah. First, we'll start with our first question. Hi Sonal. Rather a simple one. So, what space infections are involved in Ludwig's angina? So that's our first question. So name the space infections or name the spaces that are involved in Ludwig's angina. Hi Divya. So what are the spaces involved in case of Ludwig's angina? Yes, submandibular, sublingual, submental, bilateral. Good. So Ludwig's angina is a rapidly occurring cellulitis involving submandibular, sublingual and submental facial spaces, isn't it? And it's bilateral, that's very important. So bilateral involvement of submandibular, sublingual and submental facial spaces, and there is obstruction to the airway, there is no patency in the airway, so airway tract, so emergency treatment has to be instituted. Good. So as you all rightly said, bilateral involvement of submandibular, submental and sublingual spaces. Good. Now, in case of cellulitis, as you all know, there is a rapid spread of infection, isn't it? And this spread of infection, rapid spread of infection in cellulitis is mostly attributed to which of the enzymes that are secreted by Streptococcus as well as Staphylococcus bacteria. So these bacteria are commonly implicated in cellulitis. So what are the enzymes which are involved in rapid spread of infection in case of cellulitis? Yes, hyaluronidase, collagenase. Okay, so most of you say hyaluronidase and collagenase. So in case of cellulitis, Rapid spread of infection is possible because of enzymes such as streptokinase, hyaluronidase, which are produced by various strepto as well as staphylococcal species. Isn't it? Good. Yeah. Now, related to the same, like microorganisms, we go for, how do you test the efficacy of various sterilization procedures? So how do you test the efficacy of various sterilization procedures routinely? So that will be our third patient for today. Good. We use various spores, color indicators. Good. So what spores are used in order to test the efficacy of various sterilization procedures, and how frequently should these tests be done? So sterilization monitoring, as you all rightly mentioned, good. Weekly, at least weekly once, these spore tests have to be done. Good. Bacillus Staurodermophilus, and spores of Clostridium tetani. Good. Yes, Bacillus Staurodermophilus or Clostridium tetani. Fantastic. And also we have this question in our test series also. HIV, human immunodeficiency virus, is relatively easy to kill on moist surfaces. However, it is known to be resistant to which form of radiation? And this was a direct question which was even asked in a test series. Also, it was there in the previous question papers. So, to which radiation or to which race is HIV resistant? HIV is relatively easy to kill on moist environmental surfaces. Even autoclaving sterilization procedures will completely kill the HIV virus. But these HIV viruses are resistant to certain radiation. So to which radiation is HIV virus resistant? So that's the question. UV. Sejal says UV. We even posted this point in our key points. So key points pertaining to microbiology in our A classes, if you remember. Good, Niharika. Yes, Nikita, Shruti, Shivaranjani. So HIV virus is resistant to gamma rays. Isn't it? Yeah. So it is gamma rays. Good. Now, another important question. How do you evaluate the efficacy or effectiveness of disinfection? Yes, Subhashri, Prithvi, Neetu. Good. So how do you evaluate the efficacy or the efficiency of a particular disinfectant? So which microorganisms are used as test organisms on which these disinfectants are tested, and based on that we evaluate their efficacy or effectiveness. So disinfectant effectiveness is evaluated or is determined by its killing activity against which bacteria, which microorganisms. Based on the killing action against tuberculosis, Mycobacterium tuberculosis. Disinfectant effectiveness can be determined by its killing activity against Mycobacterium tuberculosis. Spirochetes, Bacillus, no. Okay, well tried. Good. Another related question pertaining to antiseptics. We had this question previously also. We have quaternary ammonium compounds. So what is the mechanism of action of quaternary ammonium compounds? In fact, the question was, quaternary ammonium compounds are bacteriostatic, bactericidal both, or they're bacteriostatic at low concentration, cidal at high concentration. So that was the question. Now, how does these quaternary ammonium compounds work? What is the mechanism of action? Bacteriostatic, antimicrobial. Okay, of course they're antimicrobial. So you mean to say bacteriostatic or bactericidal? Yes. So produces bacteriostatic. Sure, bacteriostatic. So quaternary ammonium compounds are bactericidal. They are cationic molecules, detergents that destroy the cell membrane, right? They are bactericidal. This was asked in previous entrance also. So quaternary ammonium compounds are cationic detergents that disrupt the cell membrane, and they have this bactericidal activity. Okay? It's bactericidal. Bacteriostatic at low concentration and cidal at high concentration is seen in which antibiotic? As Ishiti has put up that comment, so let's extend that. So which antibiotic is bacteriostatic at low concentration? Or name one antibiotic which is static at low and cidal at high concentration. Okay, tetracyclines, chlorhexidine, and even macrolides, erythromycin, macrolides, erythromycin, static at low, cidal at high concentration. Good. Now, okay. Name, name a microorganism, or let me just ask you this general question before going into that. Exotoxins are produced by which class of bacteria? And endotoxins are produced by which class of bacteria? That's a general question. You can answer it. It's very simple, isn't it? Exotoxins are produced by gram-positive Shruti, you say? Okay. Endotoxins by gram-negative. Okay, good. So as you all know, like exotoxins, gram-positive, endotoxins, gram-negative. Now the question is, name a gram-positive organism. Endotoxin to gram-negative. Okay. Name a gram-positive organism which produces endotoxin. A gram-positive organism which produces endotoxin. That's the question. So we do have an exception. So try giving me an answer for it. Are you sure it is Staphylococcus? Okay. I mean, do you know the answer, or are you giving me comments at random? Because as far as my my reference is concerned, there is only one gram-positive organism which releases endotoxins. So what are your references? I mean, if you have references also, yes, Pradeep, wonderful. So Pradeep, have you Googled it? So gram-positive which releases endotoxin. So Listeria monocytogenes. Good, Pradeep. Well done. The only gram-positive organism which releases endotoxins is Listeria monocytogenes. Good. Now, all of you know that hemolysis is one of the bacterial characteristic features which is associated with certain bacteria, isn't it? So we find hemolysis in some species of streptococci as well as staphylococci, isn't it? So the question now is, why do you see this hemolysis? So what is the reason for this hemolysis? Well, let me just give you one example before going ahead with this question. As you all know, streptococci, they exhibit hemolysis, isn't it? So I shall write down here. Hemolysis, example, it's exhibited by streptococci. So you have alpha hemolysis, beta hemolysis, and gamma hemolysis, isn't it? Yes, in streptococcal classification, as you all know. So why do you see this hemolysis? So what is the reason for this hemolysis? Toxins, because of toxins. Remember, these bacteria release hydrogen peroxide. This hydrogen peroxide, as a result of this release of hydrogen peroxide, there is oxidation of hemoglobin. Hemolysis is nothing but destruction of RBC, right? So the H2O2 released by this bacteria, it's going to, there is oxidation of your hemoglobin, As a result, there is destruction of your RBC and there is formation of this green pigment. So in case of alpha hemolysis, we'll have this image-based discussion later. So in case of alpha hemolysis, where you see partial hemolysis, there is slight green colored material which is present on the agar solution or on the blood agar. So this partial hemolysis is mainly because of release of hydrogen peroxide, which leads to oxidation of hemoglobin, leading to formation of a green color compound on the surface, right? So that's the reason why we find this hemolysis. So that's nothing but oxidation of hemoglobin leads to formation of methemoglobin, isn't it? So that's fine. A partial hemolysis in case of alpha hemolysis. Now, if you can broadly look into these categories, you have alpha hemolysis, beta and gamma hemolysis. So how do you remember? Because one category is partial hemolysis, the other category is complete hemolysis, whereas one category among them shows no hemolysis. So how do you remember? Yes. So remember, I hope you can see if I write down alpha. This is beta, isn't it? And this is gamma. So alpha you have A, isn't it? So A means almost. Beta you have B. B means best. Gamma you have G. G means garbage. So remember it that way, which means alpha almost. It means there is almost hemolysis, but still hemolysis is not complete, which means partial or incomplete hemolysis in case of alpha hemolysis. Whereas in case of beta hemolysis, best, which means there is complete hemolysis, pale colored or light yellow colored appearance. And G stands for garbage, which means no hemolysis, right? We had this mnemonic in our A classes also, so I am just giving you the same. So alpha hemolysis almost. So alpha hemolysis, there is partial hemolysis, beta, best, complete hemolysis, gamma, garbage, no hemolysis. No hemolysis. I'm not sure if you can see if I write there. So complete hemolysis, partial hemolysis, right? Yes, good. Wonderful. Now, we'll have a discussion of few important mediators which help in evading the host defenses, and these defenses are incorporated, or bacteria have these defenses in order to protect themselves from the host defenses, right? So we have various mediators which are released by bacteria. We'll have a brief discussion of these mediators produced by bacteria in order to evade host defenses, right? Yeah. We have capsule which is present on the surface of your bacteria. So how does capsule help the bacteria in evading or protecting itself from the host defenses? Role of capsule in evading host defenses. Yes, we have chemotoxins, we have various enzymes, surface proteins, capsules, as you all rightly mentioned. So how does capsule help the bacteria from defending itself from the host defenses? Good. Don't think I have space here. Is it okay if I write down here? Yeah. Yes, capsules prevent opsonization and phagocytosis, as you rightly mentioned. Good. And also we have various surface proteins like M protein and protein A. You can just make a note, or do you want me to write on board? It's better if I put it on board. Various surface proteins. Protein A. So what is the role of protein A? So this protein A released by Staphylococcus aureus, it inhibits. If you do you remember the role of protein A? No, difficult. Inhibits activation of complement. Yes. We have streptolysin O and streptolysin S. They are different. Good. And M protein, which is released by streptococci A, it is anti-phagocytic. So inhibits phagocytosis. Right? Okay. Bipin says no, that's fine. There is power loss. I think it is streaming, but I think there is power. Just give me a few seconds, okay? Right. I hope it is streaming. Just give me a few seconds, okay? I'm just checking out. So this is the first time we're having a loss of power in the middle of our lives. Mm, It is streaming. Okay. I mean, can you see or can you hear? Yes, we just lost power. I'm just using my mobile data now. Let me know if it is streaming fine. I mean, can you see? I can see your comments. Okay, you can see. Can you hear? I don't know why it's blank for me then. Okay, only audio. That's fine. Okay. Just give me 2 minutes, okay? I'll see if I can. Okay. Okay, Helen Keller, right? Okay, you can hear me clearly. That's fine. Okay, we're just going through these various defenses, right, which are released by bacteria, various mediators of evasion. So I'll just continue with that and then we'll stop it, okay? I'll just make a note of them on board. I'll share that in our WhatsApp group also, okay? Yeah. Okay, we'll go through comments then. I don't know how it goes, right? So protein A, as I mentioned previously, where's my pen? Yeah. I mentioned here protein A is released by Staph aureus. It inhibits complement, right? And M protein, it is anti-phagocytic. It's released by group A streptococci. Yes. Can you still hear me? I think there is some buffering. Okay. Anyways, we'll just proceed. And also we have various enzymes which act as mediators. So as you know, we have coagulase enzyme, IgA protease, leukocidins, etc. So coagulase is enzyme which promotes fibrin clot formation. So we have coagulase positive and coagulase negative biochemical tests based on which we classify the organisms also, right? So coagulase promotes fibrin clot formation. IgA protease, it degrades the antibody, secretory antibody, that is IgA. And you have leukocidins which destroy PMNs, polymorphonuclear neutrophils and macrophages, right? So I'll just mention the same on board and we'll have the pic of what I've written in our WhatsApp group as well as Google group, right? Okay, no audio also. Just give me a few seconds. Okay, now you can hear? Fine. I mean, could you what you mentioned about various enzymes? Yes. Okay. Anyways, we'll have this blind live session for a few more minutes, right? So as I mentioned, we have various enzymes like coagulase, IgA protease, and leukocidins. Coagulase, they promote fibrin clot formation. IgA protease, it degrades IgA, and leukocidins, they are mainly they have this role in destroying polymorphonuclear neutrophils. So various mediators like capsules, surface proteins, and enzymes, they have a role in enhancing the bacterial defense mechanisms against host defenses, right? Okay. Yes. Enzymes include coagulase, IgA protease, leukocidins. Anyways, I'll just mention it on board and I'll share the pic as I mentioned previously, right? Yeah. So, as one of you mentioned, it's really hard to think about blind people, how hard it is for them, isn't it? That's absolutely true. Okay, right. So, include then, I hope your preparation is going on fine. And we'll have these image based questions also soon, right? So in fact, we have prepared some image based questions, but because of time constraints and all, I think we have come back live. Mm. Yes. Now, okay, if you can hold on for 2 minutes, we have power. We'll see if you can come back live. So it's not streaming, right? Okay. Okay, you can hear now, but somehow we have a problem with the video part. Okay, we shall break them, right? Okay, you can still hear me. Okay, that's fine then, right? We'll just stop this video, we'll stop this streaming. And I actually wanted to ask you regarding these image-based questions also. Anyways, we'll see if we can make time for image-based discussion. I'll update you on WhatsApp, right? So this week and the next week I'll be a bit occupied with some work, so I couldn't really make it live as promised previously. So anyways, I'll update you regarding the live sessions in our WhatsApp update group. Okay. Yes, I can make it a recorded video. Definitely, I'll consider that awareness. Yeah. Okay. See you all then. Yeah. Bye. Good night.